Prepare oral medications. Wash hands and assemble equipment.
So your equipment that you're going to need is going to be your medication administration record. And then in looking at that, if there's pills that you need to cut, you may also need a pill cutter or a calculator to calculate the correct dose. And those should be available on the med cart at your facility.
Check the MAR for the assigned medication.
During testing, you'll be told what medications you're giving. So let's just say today I'm going to be giving the 9 o'clock meds because it's 9 o'clock.
Refer to a drug guide or consult with the pharmacist if any of the medications are unfamiliar to you.
So in looking at the MAR, the medication administration record, if any of the medications are medications you've not given before or are unaware of how they work, you can use your Nursing Central or your drug book to look those up and reference the medications.
Check for drug allergies or any other contraindications.
So you're going to check on the medication administration record itself, and I am passing medications for Luke Skywalker. There is no known drug allergies, and then I would also be checking with the patient once I get to the patient's room.
Calculate the correct dose to be given.
Okay, so I'm going to look down each medication, and I'm going to actually pull out the medication administration drawer, which has all of the medications in it that I will need. So I will actually have to be pulling out.
Utilize the triple check while preparing the medication.
Okay, so I'm going to actually find each medication. As you can see in looking, sometimes there's a lot of medications to sort through, so you have to be very careful about what you get.
Remove the bottled cap or lid for the medication properly or place the unit dose medication unopened in medication cap.
Okay, hang on one second. Once I take it out, I lay it beside that time so that I know that I have it. And so here's an example. We have prednisone, Practipred, ordered 10 milligrams daily in the AM. We have Practipred 20 milligrams, so we're going to have to split that in half. So I'm going to set that over here on this side so that I remember to do that. So my first check is when I'm taking it out. Sometimes it's difficult to find all of them. And when I'm checking with this first check, I'm making sure I have the correct medication and the correct dose, as well as the correct form. Okay, so I have all of my 9 o'clock medications. And now I'm going to check again before I put them in their pill cup. And I have this one that I need to split. So I'm going to go ahead and put this back in the drawer. And before I cut this pill, I would use an alcohol wipe to clean the pill cutter in case there is residue from previous pills that have been cut, which there usually will be. All medications that are split should be scored. If they're not scored, you need to call the pharmacy and verify that it can be split. I'm going to go ahead and cut this. I'm actually going to hold on to the half that I don't need and put the other half into here. So now I have these. I can take that with me so that I can verify one more time. The half of the pill that is cut is going to be dispensed of properly according to your facility. A lot of facilities now have black boxes in the patient's room that can be utilized for disposing of medications. If I had liquid to pour, sometimes the PRN medications come from a separate medication storage. So your instructor would tell you Robitussin, and we're going to give 2 teaspoons. So we could go ahead and pour that. To pour, we would hold the label towards our palm. We would go ahead and pour, holding it at eye, looking at it at eye level to determine that we had the correct amount. And then we would place this back in the receptacle. So the first check when we got it out, second check when we poured it, and our third check with this medication is when we replaced it into the receptacle.
Return to the bottle to shelf or drawer if applicable. Administer oral medications. Check out medications with
Hang
the
on one
client.
sec. Will you stop?